Great communities have great hospitals. The residents of Greenville and surrounding areas have access to some of the finest community-based healthcare in Michigan. Spectrum Health United Hospital, part of the Spectrum Healthcare system, offers world-class care to patients and families from all walks of life.
When I am bad, and I want to go into the hospital because I get good care, and I know I get good care. And that's really what I'm coming for, you know.
The hospital we have is first class, and I think that we have to step back, take a look at the facilities, take a look at the caring staff, and really appreciate how lucky we really are.
If it wasn't for them, he wouldn't be here today, and that's exactly true. He wouldn't be, because it was a matter of minutes and he would have been gone.
Our advantage is that obviously we have a direct connection with Spectrum in real time, that we can connect with specialists on an as-needed basis.
Some of life's most defining moments come when least expected. From sickness to trauma to simple stitches in a finger, access to emergency care is vital to a community and its residents. From 15,000 patients annually 5 years ago, nearly 30,000 patients will seek care in Greenville's emergency room this year.
They got me right in, promptly got me in. They hooked me up to some heart monitoring equipment, and probably within 10 minutes I experienced a heart attack and flatlined. Luckily, these guys were close by, and I was right place, right time.
When he came in, it was a total team effort. The resources and the experience of Dr. DeWise, of course, certainly played a huge part in taking care of Lowell. After all said and done, it was a totally humbling experience to see Lowell come out the way he did.
Well, it was just before Thanksgiving, and I had an accident. My dad ended up rushing me here to the ER, and they rushed me right into a bed and took really good care of me. Well, after they got the bleeding under control, they ended up aerometing me out to Butterworth in Grand Rapids, and I got a ride on a helicopter there. The staff on the helicopter were really great. Oh, I think they didn't just save my arm, they saved my life.
I think we give excellent care. When you come to our emergency room, you're going to see the same doctors here that you're going to see at Butterworth.
I was downtown, almost noon. Somehow I just didn't feel right. The next thing I knew, the medics were there with the truck, and they were checking me out, and then they brought me up here. Well, it just gives you a great feeling of confidence when you come in here. I don't particularly like to go into a hospital or a doctor if I don't have to, but if I've got to be somewhere, I'd want to be here.
People and facilities are only a part of successful patient outcomes. Progressive technology plays a key role, particularly for emergency patients who are among the most critical. Today, most of Greenville's hospital uses wireless telemetry, a system that allows patients to be continuously monitored regardless of their location. Presently, this state-of-the-art technology is not available in the emergency room for those patients most in need.
The biggest thing with the patients is they don't have to ask for help as much. They're not connected to a wall, they're not connected to, any type of stationary object. So they're capable of getting up and using the restroom, or sitting up in a chair, or wandering around the hospital. We encourage people to get up and walk so they don't have to ask for assistance. It's much better being able to watch your patients anywhere that they go. It makes you feel more comfortable. The patient feels safer knowing that they're being watched. But it's great for the patients and the staff.
The most critical inpatients, obviously, when they come down for care in the X-ray department, they have the portable telemetry so that we can monitor pretty much their every move and make sure that their body's functioning the way it needs to be functioning. However, in the emergency room, we do not currently have that option.
Well, the cutting-edge technology that we need today is important, and in the aspects of when we take a patient from the emergency room over to different departments, that we're able to still keep an eye on them and making sure that their well-being is being monitored as closely as possible.
It would be awesome to be able to send our patients over to the DI department, have their CAT scans, x-rays, and be able to monitor them the entire time that they're over there.
Great hospitals are made possible by generous donors, whatever their capability. The spirit of philanthropy and giving is alive and well in the Greenville area community. An investment in wireless telemetry for our emergency room will not only save lives, but will reinforce Greenville's spirit of giving.
This is going to pay them the biggest dividends they'd ever get, to put their money in this organization.
We really do appreciate everything that the foundation provides for us to help not only giving us equipment, but also just a connection with the community, which is very important.
Continued investment in your local hospital is one of the greatest gifts you as a donor can make.
I would like to thank the foundation for everything that they do for this department.
Thank you for all you do.
We appreciate all you do for us.
Thank you.
Thank you.
Thank you for supporting the foundation.
Thank you for all you do.
Thank you. Thank you.
Bill, you want to say thanks one last time for them saving your bacon place?
Well, I certainly do appreciate it. You know, I'd rather be on the green side of the sod than under it.